Welcome to the Peak Performance Podcast, your guide to optimizing your life one health tip at a time. This podcast is designed to entertain and inform, not to provide medical or health advice. Always consult your doctor when it comes to your personal health or before you make any changes to your diet, exercise, or lifestyle.
Ladies and gentlemen, welcome to the Peak Performance Podcast. Today we're talking about ozone. We're going to jump right in.
What is ozone, Kyle?
I don't know. I heard it's going away and we're all going to freeze. Is that something with the ice age?
I mean, I've heard I breathe it in, it might kill me.
Yeah, well, that's possible too. Well, basically ozone, at its simplest, is just O3. So 3 molecules of oxygen.
What do we do with them? Why do we care?
Well, I do know that O3 can eventually sometimes go to O2. And oxygen is a good thing. It's kind of like that song, rain is a good thing, but it's oxygen. So we want to get to O2 from O3. So I think you're going to explain how we do that.
Yeah, let's talk about it. So the best way to utilize ozone is to get it into your bloodstream. Obviously, the best way to do that is to give you an IV of ozone. But if we just ran an IV of ozone into you, that probably wouldn't end the best. I'm not saying it's I'm not saying it's impossible. I'm just not saying it would end the best. Typically, the way we do it is we remove blood from your body, mix ozone with it, run it back into you. That's because ozone reacting with your blood is an exothermic reaction. So we just want that reaction, that heat production, to happen outside of your body instead of inside your body. There is a tangential thing called DIV, direct intravenous ozone. We don't do that here in America, but basically you just inject ozone straight into the bloodstream very slowly. Because ozone is literally just pure O2 and O3, it can't actually cause an air embolism. It's nitrogen that causes the air embolism. If you put ozone or oxygen directly into your bloodstream, your red blood cells will just absorb it, same as in your lungs. That's why it doesn't kill you to do it.
So ozone is a molecule, 3 molecules of oxygen, essentially. And then when you get ozone, basically it's a beneficial compound that helps do things in the body. The best way to do it is probably through an IV treatment.
Yep, we're there so far. I've been rambling, but you're right.
So I just want to cover that for the layman because you said a lot of big words. He said exothermic, and I was like, oh goodness, here we go. Sometimes I go off on the big words, but Dr. K's got us today. So basically, it's this molecule that has some kind of benefit in the body that we inject through IV. Are there other ways to get it in our body?
You can do direct injections of it with a needle and a syringe. You can apply it topically. And then there's also rectal and vaginal ozone. And then actually there's also nasal insufflation. You can put it in your ears. I know dentists use it for mouth stuff. I've used it for mouth stuff on myself. So basically, if a hole exists in your body, you can put ozone into it.
It's a molecule, but how does it help us? How does giving us that extra O from O2 to O3, how does that do us any good?
So there's a few different things that ozone does in the body. And I'm going to speak kind of generally. I'm not going to bore you guys with the exact science of it. Really, the main things it does are decreases free radicals in your body. Do we know what free radicals are?
Yeah, they're just like a little, I want to say, it's a negatively charged ion?
Yeah, they're ions that bounce around your bodies. And they're at a microscopic level, like they're the DNA size level. And the same reason that we take antioxidants like blueberries and wine is to reduce our free radical burden. Ozone does the same thing, but does it at a way higher concentration than wine or blueberry. We're talking hundreds, thousands.
Are the free radicals negatively or positively charged? That's what I can't remember.
So it's O3 minus. When ozone reacts with blood, it makes a particle called ozonides, which are O3 minus.
Okay, so the free radicals are positively charged. And so ozone has a strong negative.
Yes, free radicals are positively charged.
Yeah, it has a strong negative charge, which can suck all those free radical inflammation-causing things out of you. They can grow. Actually, I guess it doesn't suck them out. It forms with them to make a neutrally charged atom.
Correct. So ozone, when you make ozone, it carries a charge, and then when it reacts with your blood, it becomes an O3 minus. Then it binds to free radicals in your body, becomes O3. O3 doesn't like to be stable. It doesn't like to be not charged in any way or the other. And we're going back to like high school chemistry, so it doesn't really matter that much. But basically, it ends up getting sucked into your mitochondria pretty quickly. And for those of you that remember high school biology, the Krebs cycle, Kreb, Krebs cycle. That's basically the fancy name for how mitochondria, which is the powerhouse of the cell, the thing that makes all of our energy, it's how it makes the energy. It normally takes O2 and splits into O and O, and you get two chains of energy out of that called ATP. When you give them O3, through that same process, you actually get a third chain of energy, basically for free. So effectively, it's a 33% boost to the cells that manage to get hit with an ozone particle.
Correct me if I'm wrong, but if you get this energy boost from it, and this is one of the benefits, do you want to hit as many cells as you possibly can?
Correct. Yeah, ozone is all about the quantity of blood you treat. The more blood you treat, the bigger the effects of ozone are.
Okay. So let's keep circling back to benefits. So it clears out free radicals. It increases your energy through the Krebs cycle with the extra ATP molecule. And then, like, what do people see on a more tangible level, less biological?
The next thing is it's really anti-inflammatory. So it just calms down inflammation in your body. And we were talking about EBOO specifically, and we're going to explain all the different types of ozone. EBOO is just basically the most powerful one. But as we reduce inflammation, that's a noticeable benefit. The next benefit, and this one's more a biological level, is it can actually stimulate your immune system to function higher. It can turn what are called Th1 cells into what are called Th2 cells. Basically, it's activating your dormant immune system to fight infections stronger or harder.
We've got inflammation, clearing up free radicals. We've got improved immune system, and we've got more energy. So this is not something you see that will maybe athletes could use to increase their performance, or could they?
Oh, yeah, absolutely. So the last benefit is hyperoxygenation. Basically, a red blood cell is traveling through the bloodstream. It's got oxygen basically on its back. And as it travels through, that oxygen gets plucked off and replaced with a carbon dioxide. But if we put an O3 on that red blood cell, it's going to travel further because it has one extra one. So it's going to travel further before it runs empty. So basically, we're going to bring more oxygen to normally less oxygenated places like your eyes, your kidneys, your heart. Things that are last in line are now going to be first in line. And so when you hyperoxygenate your tissue, it can repair and rebuild faster. And plus, you're going to have noticeable effects. I have people that tell me that they can see better for a few hours after doing ozone. More energy is definitely a noticeable benefit. And so we have professional athletes, they'll come do ozone after hard workouts or before big games because they notice it does provide an edge for them when playing. And, ozone is fully allowed. Currently, it's fully allowed by all major professional athletic associations.
Yeah, kind of flies under the radar for athletic performance enhancing.
I think they know about it. It's just how do you regulate oxygen?
You can't breathe deep. Not allowed in your sport.
So I think that's really why it's allowed is one, you can't test for it. And two, what are you going to say? You can't be above 100% oxygen saturation. So what are you going to say?
There's no way to show that they actually did it unless they tracked them. So tell me about ozone and the side effects. So are there any side effects? Are we going to just instantly feel amazing, or is there like a detox or something like that happens? Because it seems like it is somewhat of a poisonous molecule to things in high concentrations, like mold, because it can be used to remediate mold.
Yeah. So obviously the number one side effect, don't breathe in ozone. It is a lung irritant. It's actually not poisonous. So I want to clarify this for everyone because I get this question often. So the reason that ozone is associated with being poisonous is because in the environment, when they say ozone levels are high, people associate that as it being toxic. Like on the Weather Channel. Really what it is, ozone is the easiest thing to measure in our environment. It is a byproduct of all those other toxic things being produced in our environment. But those other things are more costly and harder to measure. So they found that they can just measure ozone levels and then know that those other things are also high.
So you're talking like, when chemicals are being made or factories are making stuff, they're pumping stuff out into the atmosphere. And one of the byproducts is ozone, but they can't really measure the other chemicals as well, or it's cheaply, so they just measure the ozone.
Correct.
I didn't know that. There you go. See, folks, I'm learning here too today.
Yeah, so that's where ozone got its bad name, and now unfortunately it's stuck with it.
It is toxic to certain organisms, though. So like I mentioned, it will actually kill mold. It's one of the very few things that will actually kill mold. Like bleach won't do it. Hydrogen peroxide is another thing that'll kill it, but it's not poisonous to us. Can it kill us?
I don't know how you would be able to, honestly. I guess if you pumped a ton of it straight into an IV very quickly, yes, but other than that, not really.
Like breathes a ton of it in, like pure ozone.
Yeah, I guess if you sat in a room full of ozone for like 30 minutes, it might crisp your lungs, but that, I mean, you'd be so miserable in that room. I don't think you'd be able to sit in that room.
Okay, so it's not really dangerous.
No, but side effects. So there's three groups of people when it comes to ozone treatments. We're talking IV to start with. There's people that feel better immediately. There's people that feel worse immediately. And then there's people that feel nothing. People that feel better immediately, usually those are pretty healthy people. And when we give them ozone, they get that extra energy benefit. They get that hyperoxygenation benefit, and they just feel good. Their body's healing. Things are happy. We get to move on. They'll sometimes do more of them just because it makes them feel good. Then there's people that feel worse. Typically, this is known as called a Herxheimer reaction. And Herxheimer reaction, it is a specific definition of flu-like symptoms in response to a die-off effect of a infection or toxin. Was that simple enough definition?
Yeah, I think that was pretty good. Basically, you're detoxing and you feel bad.
Yep. So Herxheimer is a specific group of symptoms, and then there's a more broad category of detox effects. And I typically just call those an exacerbation of your symptoms. Whatever you feel, you just feel worse. If you have fatigue, you have more fatigue, you have brain fog, more brain fog, etc. And what happens is the ozone's killing whatever it's killing in such a high quantity concentration that your body, it's dumping mechanisms for removing that toxin. They're just overwhelmed. And so it starts to build up in your body.
And then your body has to clear it, and that's why you're feeling it.
Yeah, you're getting bottlenecked on your detox pathways.
Gotcha.
And then there's the people that feel nothing. Now, these are the most interesting people, right? Because these are the ones that need more ozone treatments, and it's really hard to explain to them why. Because pretty much one out of every three people I get, they're like, oh, I didn't feel much from that. I don't want to do it anymore. I'm like, but if you're healthy, you should feel good from ozone. That's what's supposed to happen. Basically what I'm hearing is that it's working on something. We don't know what it's working on. It's being targeted towards something. So you're not getting any extra benefits, but whatever it's working on isn't bad enough for you to detox, bottleneck. You're keeping up with whatever it's doing, but who knows what it's doing.
Yeah. So those people, if they kept doing it, most likely would get to the point where they would feel good afterwards.
Yeah. Some of my patients actually do listen to me. And when they feel nothing, they'll actually keep going. And, once we've done enough varies. Sometimes enough is like one or two more. Sometimes enough is like 10 more. But once we do enough, they will eventually start to feel better. Okay. So we talked about side effects. We talked about benefits in the body. What's next?
So we talked about how to administer, but I'd like to go into a bit more detail how to administer in each different one. So we started with IV, and I'll let you go into that, but I just want to quickly explain rectal insufflation. So basically, rectal insufflation is the most popular way to administer ozone at home. You can buy an ozone generator for $600 to $1,000. You can get
Not anymore.
Wait, not anymore? Are they more expensive now?
Like the real companies that you can actually trust are like $3,000 now.
Ooh, they got expensive. Anyway, you can buy these things at home, and then you get you either get a medical grade oxygen regulator or you get a industrial grade oxygen regulator, and you hook it up. The generator makes ozone from your oxygen.
Yeah, so they say it takes roughly 3 rectal treatments to equal 1 simple ozone. And I'm going to explain what I mean by simple ozone in a second. But it's roughly 3 to 1 to the starting level of IV ozone.
Yeah. So, I mean, in the grand scheme of things, doing a rectal ozone treatment is a good option if you don't have access to a doctor that provides this, or cost considerations are a main thing for you. But going to do one ozone treatment in Dr. K's office, especially his EBOO, is much like doing probably 50 or 60 rectal insufflations.
What I've learned is you really can't compare EBOO to regular IV ozone or rectal anymore. It's just so different. It's just no comparison level anymore.
Okay. So the moral of the story is an IV is way more effective because you get exposed to way more ozone. You get more treatment of ozone. And you can only take so much rectally before you start having weird side effects. So don't do more than 1 bag at a time.
Yeah. So ozone. So the way you calculate strength of ozone is you multiply its volume, the amount of ozone you're doing, multiplied by its gamma. And gamma is just the strength of ozone, which is measured as micrograms per milliliter. Not relevant. It's just anywhere from 1 to, we stop at 70 because that's about your safe level. We technically up to 100. And then there's a third factor that's often not talked about. It's your diffusion factor. Basically, how well the ozone can interact with the surface. And that's the main reason why IV is better than any of the insufflations. It just diffuses better into your blood than it does through your mucosal tissue, mucosal being like a rectal tissue.
Gotcha. Okay. So the diffusion factor, Dr. K, is how effectively that ozone can get into the bloodstream or onto the red blood cells. Or is it the same thing, really?
That's basically the same thing. Basically, you need to get it into your bloodstream, and once it's in your bloodstream, it's going to bind to red blood cells instantly.
Okay. So it can't travel through the mucosal layer as effectively as it can if you just put it right into the blood.
Correct. And then, as long as we're on rectal, let's get into ear, nose, mouth insufflation at the same time. So the trick to doing ear, let's start with ear. The trick to doing ear is you have to wet your ears first, because moistening your ears actually increases your diffusion factor. But basically, they sell these as well. Once you buy the ozone generator, you can buy accessories for it. One of the accessories is a stethoscope. And then you put the stethoscope in your ear, you turn on your ozone machine, and once again, your gamma could be anywhere between 1 and 70 is your safe limit. And then you sit there for 15 minutes and let it crank into your ears. I typically only use ear insufflation for ear or sinus issues. I know doctors that all they have is an ear insufflation machine, and they swear that it works, for treating whole body issues. I just find it's a lot slower. So it's kind of like, what are we really doing here, guys? But for ear and stuff, it works great. The one caution, if they have a ruptured eardrum, do not do it. They will feel so terrible, so miserable, so dizzy.
How do you know if you have a ruptured eardrum?
They know, honestly.
Yeah, you put it on, you're like, ow, it hurts. And then you're like, okay.
No, like that. They'll know in advance. Because one, it hurts when it happens. Two, your hearing perception changes a little bit. If you're worried about it, have your doctor, most doctors have an ear looker thing in their office. Just have them take a peek in your ears before you do it if you're really worried.
Is that what they're looking for when I go to the doctor every time? They get that little light thing out?
That's one of the things, too. They're looking for like ear infections and stuff.
So it can knock out an ear infection. Ozone in the ears.
I've used it for that. It works quite well, yeah.
I've heard a lot of different stories from a lot of different doctors and biohackers like me that have used it successfully for ear infections also. And it seems to be like, what I've heard is 1 to 2 treatments, and then really bad ones need like 3.
Yeah. And we're talking, day 1, day 2, day 3. We're not talking like, 1 a week, because at that point, just take antibiotics.
Okay, so you did ear. We got nose.
So there's 2 ways to do nose. There's the meaner way that I do on my patients, and then there's the nicer way. I find the meaner way just works faster, honestly. So the nicer way, you run it through a ozone bubbler. Once again, an accessory you buy to your home ozone generator. Basically, it's the ozone feeds into this like glass device that has water in it, bubbles through the water. That takes basically the sting out of the ozone, and then you breathe it in.
Are you saying there's an ozone bong?
I didn't say that, but I guess.
That's what it sounded like. That's what you explained.
I mean, I guess that's technically it, yeah.
So the ozone flows through it, and then you breathe in the vapor, or you try to like breathe in the water?
No, you breathe in the vapor.
Is it hot?
No, it's not hot. It's whatever temperature the water is. And then it's not so much a lung irritant anymore. I guess technically breathing enough in it still could be, but it's so reduced that doing a 5 to 10 minute treatment of it won't irritate your lungs. And then there's the other way I do it, which is I fill up a big syringe with ozone, and I won't go higher than 20 gamma. And you hold your breath, shoot it straight up your nose. You can, if you do enough, you'll actually fill into the sinuses, and then you hold your breath for 30 seconds and then breathe out through your nose. And that works great. I use that for sinus issues, even allergies. It'll pause allergies in people for a few weeks.
Oh wow! You don't actually like inject it there. You just spray it up, right?
Correct. Yeah. It's not going through the skin. It's just, you take a syringe and straight up the nose.
Okay.
And so their nose will run anywhere from 20 minutes to a few hours after. And it's pretty burny for the first 20 minutes. You don't want to go too high because you'll actually burn nasal tissue if you go too high. So you keep it at low gamma. And then afterwards, it works quite well. It's kind of sterilizing all that tissue. And then the last option is oral. So you can inject it. So I know dentists that inject it into, if they're doing a, tooth repair, they'll inject it into the gums or inject it into the tooth repair. What that does, if you inject into tooth repair, cavity, root canal, implant, whatever, it'll sterilize all the tissues. So you significantly reduce your possibility of infection. The other option, I've done gum injections. It can help with gum inflammation, gum recession. This is direct injections into the gums.
Okay. So we got ear, nose, we got gums, mouth, we've got rectal insufflation, and now we're going to either topical or IV.
I was going to say, I could keep distracting. I remember another one called bladder.
Huh.
You can actually, you can put a Foley catheter in and inject ozone straight into the bladder. Bladder cystitis, it's really quite good for that. Chronic inflammation, infection of the bladder. You put ozone straight up there and it works quite well. Okay, now let's get into IV. Okay, so IV, like we mentioned, IV is all about, the strength multiplied by the volume, multiplied by the diffusion factor. But the way you increase the amount of ozone that you can apply is you increase the quantity of blood that you are removing to treat. So the base one is, there's a few levels. So let me explain the levels first. There's simple or minor autohemotherapy. This is 60 to 100 cc's of blood. Take it out into a bag, mix it with blood, run it back in. There's major autohemotherapy. This is 200 cc's of blood to pull out into a bag, mix it with ozone, run it back in. There is multi-pass or 10-pass. This is 200 cc's of blood per pass. It can be done up to 10 times, just into a glass bottle and back into. And then there's EBOO. And EBOO is extracorporeal blood oxygenation and ozonation, or ozone dialysis is its generic name. So let's start with simple. Simple, we're going to take out 60 to 100 cc's of blood. We're going to double whatever amount of blood we take out, we're going to double it. And that's the amount of ozone we're putting in. This process takes about 20-30 minutes just for it to drip back in. There's no pressure on this, so I put mine in saline to keep it from clotting. Plus, it adds a little bit more surface area for the ozone to bind with. Because ozone, you can also do hyperozonated saline infusions where you just take a bag of saline, put ozone into it, and drip it back in. If you can't get blood out of someone, there's an okay way to do it. Not quite the same diffusion factor. But anyway, so we drip that into you. The next is major autohemotherapy. So this is the most common one in America right now. It is a big bag like this. They usually put it on the floor. Some fancier people have a vacuum for it. The blood runs out. It fills this bag. It takes like 30 minutes to fill this bag. They mix ozone with it. They run it back into you. So it takes about 45 minutes per pass. They could do up to 3 passes with it. So if you're doing 3 passes, you're sitting there for like almost 2 hours. So it's quite a process. It works really well, but it's quite a process. The next one is multi-pass. Like I mentioned, it's 200 cc's of blood per pass. And you could do a pass in like 3 to 5 minutes, depending on your blood flow. So even 10 passes, you're done in like 50 minutes. So it is superior to major autohemotherapy. It's not as popular. Really, there's only 2 companies that make a multi-pass machine. One is a German machine called Zotzmann and Stahl, or new name is Aqua Pro. And then I forget the other American company's name. This is what I have in my office. And up until I got an EBOO, that's the bulk of what I did was the multi-pass.
So the multi-pass, a lot of doctors will offer ozone, but don't quite do the multi-pass because of how labor intensive it is, correct?
You're attacked. So all the other ones, you pretty much turn it on, walk away, come back in a bit, do something else, and walk away again. Multi-pass, you are glued to this bottle for like an hour.
The doctor is glued to this bottle. The patient's glued to the chair no matter what they're doing.
Yes. So, I'm constantly interacting with the bottle. You have to keep swirling it so it doesn't clot. There's a pump, there's a vacuum that you have to keep playing with to maintain your pressures.
You said 10 pass. Do people start at 10 pass or do they work up or like how does that work?
No, so we always work up. This is more ozone. Unless you've done EBOO treatments, and EBOO is still a little bit different. Unless you've done multi-passes before, really, you have to work your way up just because it's so much ozone. You've never experienced this much before, even if you've done major autohemotherapy. So you can definitely have detox reactions to it. So we always go 3 passes, then 5 passes, then 8 passes, then 10 passes. Most people stop at 10 passes.
So you can go up to, safely, larger people who have done a lot of multi-pass can probably go up to around 13, 14, 15 passes, but it's very rare to go over 10.
Correct.
Usually, 10 will get you where you want to go with benefits as well.
Yeah, pretty much.
Okay, gotcha. And then you keep saying this thing that sounds like a large bird, EBOO, extracorporeal blood oxygenation ozonation.
EBOO, it's a 15-minute treatment. We hook an IV into one arm and then into the other arm. And so it's a continuous loop. So we pull blood out of one arm. It runs through a pump, which, moves all your blood, hits our filter. It's actually a dialysis filter. So it can actually filter solid waste material. Ozone comes down from the top as blood travels up, comes out, runs under ultraviolet light, and then back into the patient. Runs continuously for 50 minutes, so it's a constant loop. You can treat anywhere from if you really push, you'd probably get close to 4 liters of blood. So anywhere from 1/3 to 2/3 of your total blood volume in that 50 minutes.
This is the most exposure you can get to ozone.
By far. So I kept talking about diffusion factor. And the reason no one's ever really talked about diffusion factor before is it hasn't really mattered before. So most of those other ozone treatments, ozone rises to the top because it's a gas, sits above the blood, and that's pretty much it. With EBOO, that filter, so the filter, it's about this big. It's about a foot tall and 2 inches in diameter. But it has 1.5 square meters of surface area in it, which is massive. That's about 5 by 5 feet of surface area, which is huge. And so your blood is getting spread out really, really thinly. And so you have a massive diffusion factor. So my best estimate, I'm sure there are people out there that will disagree with me, but my best estimate is your diffusion factor for multipass or major or whatever is probably about 0.1, to 0.2 at best. Whereas with EBOO, we're probably hitting a diffusion factor of 0.9. And so even though EBOO runs at a lower gamma, your diffusion factor is so high that you're getting way more into your bloodstream. Along with that, with that inflammatory waste I mentioned. So I put it like this. The more sick someone is, the more inflamed they are. And the more inflamed you are, the more water you retain, if that makes sense. And so when you take that inflamed blood and you run it against a pressurized gradient, which that filter, because it's having ozone fed into it all the time, is pressurized. When you run the inflamed blood through a pressurized gradient, you're going to strip out that inflammatory fluid. And we just collect all the bucket at the bottom so you can see how much came at you. So that's really the bigger 2 benefits. And that's why you can't compare EBOO to the other ozone treatments. It's the 2 big things. It's the filter, so you're removing solid waste material, things like heavy metals and molds and viruses and bacteria and fungi and whatever else is in your bloodstream that shouldn't be. And the other part of it is removing all that inflammatory fluid, which you don't do with the other ozone treatments.
It's like an oil change for your body. Essentially, we're getting rid of all of the bad stuff, including solid, and the ozone is actually working on infections and other things that aren't necessarily solid and wouldn't be trapped in the filter, pulling out the inflammatory waste, and then good, clean, healthy blood is coming back in.
Correct.
You mentioned that the more inflamed you are, the more water your body holds, the more fluid you hold, and that comes off in the fluid bucket, basically, when you're doing an EBOO.
One of the cooler stories I had a patient come in, and she may be listening to this. I had a patient come in, and she had issues urinating for months. She really couldn't get a solid stream, which is extremely unusual in a female, right? We did an EBOO on her, and she goes to the bathroom right after, and she said that was the first solid stream she had in months. And it lasted 4 or 5 days for her. So she came in again next week, and we did it again. And again, it lasted a week for her. So it's really super interesting why that is.
It's probably just so much toxic burden on the kidneys that it gave it that chance to kind of regenerate and catch up and function properly. Or maybe it made the kidneys themselves and the whole system less inflamed, so it just flowed better.
Something.
Wow. So so someone comes in, I'm coming into your office. I want to do ozone. I heard your podcast. I heard the benefits. What should I do?
So that's honestly the hardest question. Unfortunately, it comes down to budget. Just because ozone IV, it's not cheap. And so I put it like this. If everything was free, everyone would just do EBOOs all the time. Just because I found they're so much better. You can't compare. You could do as many multi-passes or majors as you want. You're still not going to compare it to one EBOO.
So price-wise, I've seen prices all over the scale for ozone, up and down, left and right for all the different types. But, do you mind giving us ranges of what you've seen for the different levels?
Yeah, so every year or two, we actually try and look at local and national averages of prices to kind of make sure that we're staying competitive. So simple ozone seems to range between $200 and $300. That includes the ultraviolet light. So range between $200 and $300, or without between $150 and $225. Major, I forget. We don't do major, so I don't know its price off the top of my head. I don't know if you know, Kyle.
I've heard anywhere from $500 to $1,500 for 3 rounds of it.
For 3 rounds. You mean 3 passes or 3 treatments?
3 passes.
So $500 per pass, basically?
Roughly. Yeah, that's kind of what I've heard. It varies depending on where you are and how expensive the doctor you're seeing, and definitely the city you're in.
Gotcha. multi-pass, this one's harder to compare just because there's not so many of them. We start at 365 and go up to 880 for 10 passes, including the light. So that's kind of the range for it. And, I've seen up to 1200 seems to be the highest I've seen. Someone out there may be charging more, I don't know.
Yeah.
And then EBOO, as far as I know, we currently have the cheapest price in the country at $1,000, including the ultraviolet light. And then the highest I've seen is 2,700 for one treatment.
Yeah. I think I've seen $900, but I'm pretty sure it was a introductory special from a doctor who just got the machine. So
that would make sense.
So, but I have seen a lot of 1500s and 2000s, especially in the major cities. That seems to be the kind of going rate in the major cities. So, like you said, it's really what it comes down to budget. Maybe a good approach would be, save your money, get an EBOO and maybe an at-home rectal generator. So that way, you can get a really strong first session and then kind of a maintenance with that home.
I would rather people do one EBOO treatment than 3 or 4 simple ozones, honestly.
Yeah, just has that much more bang for the buck. Okay, so we talked about IV. You mentioned topical, and I have not heard of this.
So there's cosmetic, which actually is injections. You can inject it into wrinkles, into scars. You can do hair regeneration with it as well. Those, you're injecting it twice a week for usually about 6 to 8 weeks, low dose ozone. And what it does, it stimulates blood flow. It stimulates a little bit of collagen production. So it's trying to restore the skin, or for hair, trying to restore blood flow to the follicles. And then there's straight topical, which is where you make ozone oil. You take ozone, you mix it with a carrier oil, olive oil or hemp oil. Hemp oil is actually the best. It's just more expensive. It only lasts 3 weeks no matter what you bind it with. It doesn't matter. And then you can apply it. The main things I apply for are cosmetic issues for the face. Helps basically look younger. It's a really good anti-aging one. And then the other thing I use it for often is like fungal nail infections. You just put it on every day. It still takes like 6 to 8 weeks, but at least you're using a natural something instead of antifungal topicals. And then you can also drip into ears for chronic ear issues.
Huh. Yeah, that's a whole new world for me, although it makes sense. So we didn't mention ozone injections at all. And I believe that's a thing. I think you call it prolozone, something like that.
We do call it prolozone, yep. So there's 2 ways to do prolozone injections. There's you can either inject straight ozone gas, or you can inject, I know people mix the ozone gas with like dextrose to make, that's true prolozone, I suppose, because it's prolotherapy, which is dextrose injections combined with ozone. And what that does, when you inject ozone into a joint, or unless you're really experienced with it, I don't recommend tendon or ligament injections with ozone, just because it hurts so much. So we don't numb up really well. But basically, it hyperoxygenates the area. So trying to increase blood flow, increase healing factors, stuff like that. I don't often do prolozone by itself. I haven't found it to be as effective as prolotherapy. It's good at reducing inflammation, but if you're looking for long-term healing, I'd rather you do prolotherapy than prolozone. I often will just do prolozone or ozone injections first, wait about 10 minutes, and then do the PRP or the stem cells. It provides a good seeding ground for the injections.
Ozone, did we miss anything?
We covered benefits. We covered ways to do it. We covered detox effects, cost.
I think we nailed it.
I think that's pretty much it.
Yeah. So Dr. K, it was good to talk to you. And signing off, this is Coach Kyle. You can find me at ToxinFree Kyle on Instagram.
And this is Dr. K, or the OsteoDoc on Instagram. Thanks everybody for listening, and we'll see you next time.
Thank you, guys.
Thanks for tuning in to another episode of the Peak Performance Podcast, your #1 resource for today's top health hacks and facts. You can follow us on Instagram at the Peak Performance Pod or on X at Peak Perform Pod. You can also check out our website and weekly blogs at peakperformancepodcast.online. Again, thanks for watching, and don't forget to subscribe. We put out a new podcast every Thursday. The content of this podcast is provided for informational purposes only and is not intended for the purposes of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the product. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Coach Kyle, Dr. K, and producers, disclaim responsibility for any possible adverse effects from the use of the information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein.